If you are older and do not ejaculate, do so immediately. Urologist Explains to you this message is directed, particularly if you have traversed the journey of life to a certain age, perhaps beyond the 5th or 6th decade, and have begun to observe a notable, sometimes startling, shift in your most intimate experiences. Specifically, you might still fully immerse yourself in the profound intensity of pleasure, reaching that peak sensation of climax, yet find yourself pondering the curious absence of the expected release of seminal fluid. Should this scenario resonate with your personal experience, it is absolutely crucial for you to understand, without reservation, that you are far from being alone in this. More significantly, there is nothing inherently broken or fundamentally flawed about you or your body. The initial surge of apprehension or profound worry that might naturally accompany such a realization is not only completely understandable, but also represents a perfectly natural, albeit unsettling, human response to an unexpected change within your own physiological landscape. However, a subtle, often initially imperceptible pattern frequently underlies this experience, a pattern that many men do not fully grasp or acknowledge until it begins to manifest itself repeatedly. The moment you begin to truly understand the deeper underlying mechanics of this pattern, the initial wave of uncertainty and concern that can flood your mind often starts to recede. This transformation occurs because the issue evolves from a vague, unsettling worry into something specific, identifiable, and most importantly, profoundly manageable. Within the framework of this comprehensive discussion, I, Dr. Olivia, a urologist who has dedicated 12 years to specializing in men's vital health across every stage of their lives, will meticulously guide you through what this particular change typically signifies. We will explore what it might, on occasion, indicate concerning your broader overall health and precisely what a urologist's initial systematic approach to assessment usually entails. Our ultimate and unwavering goal is to empower you, transitioning you from a state of anxious guessing and apprehension to one of clear, well-founded understanding and confident assurance. The experience of achieving a complete and intense climax without the accompanying familiar physical release of fluid can be, for many, deeply unsettling and profoundly disorienting. For some individuals, it might have been a singular, startling event that instantly knotted their stomach with a profound sense of worry and confusion. For others, it could be a recurring silent issue, something they have quietly borne alone, perhaps tinged with a pervasive sense of shame or a quiet, gnawing apprehension about the potential implications for their long-term health and well-being. I wish to underscore right from the very outset of our conversation that your concern is absolutely valid, and I am here to address it with the utmost seriousness, professional expertise, and profound supportive care. This particular change within your body is most certainly not an indication that your masculinity has somehow expired, nor does it signal an inevitable end to your vibrant, intimate life. Rather than perceiving it as some form of personal failure or a sign of decline, it is more constructive and accurate to consider it as a detailed, intricate message that your body is attempting to send you, a message that simply needs to be carefully decoded and understood. Therefore, I earnestly request that you stay with me as we meticulously explore the often surprising underlying causes of this phenomenon, delve into the critical warning signs that you absolutely should be aware of, and most importantly, reveal the clear, actionable, and entirely manageable solutions that modern medicine currently offers. These solutions are designed not only to restore your peace of mind and bolster your confidence, but also to significantly enhance your overall well-being and quality of life. Before we delve into the intricate specifics of what precisely occurs when seminal fluid is absent during climax, let us first take a brief yet absolutely essential look at the normal, healthy, physiological process of ejaculation. To truly grasp this, consider your body's reproductive system as an exquisitely synchronized orchestra where each individual part plays its unique role with precision and harmony. The testicles, fundamental to this system, are primarily responsible for the continuous production of sperm. Following this, the seminal vesicles contribute the vast majority of the nourishing, rich seminal fluid, a substance crucial for sperm viability and transport. Concurrently, the prostate gland adds its own distinctive protective fluid, further enriching the overall composition. This combined complex fluid cocktail is then carefully gathered and precisely prepared within the urethra, awaiting its moment of expulsion. When climax is reached, a very specific and powerful series of rhythmic muscle contractions is initiated. These coordinated contractions serve to propel this fluid mixture forcefully forward and out of the body. This entire intricate event is remarkably rapid, a testament to the delicate and perfectly synchronized timing that exists between your nervous system, various glands, and the multitude of muscular contractions involved. It is absolutely vital to make a crucial and often overlooked distinction here. Gentlemen, climax and ejaculation are not, in fact, the same phenomenon, even though they typically occur together as a single, seamless event. Climax is fundamentally the neurological sensation of intense pleasure, a complex experience orchestrated by the sophisticated workings of your brain and central nervous system. Ejaculation, on the other hand, is the purely physical, mechanical act of expelling the seminal fluid. For the vast majority of your life, these two distinct events blend together so perfectly that they are perceived as one. However, they are indeed driven by separate, albeit interconnected, physiological mechanisms. Our primary focus today, therefore, is on what is technically and medically known as dry ejaculation, a state where a man experiences the full, intense sensation of climax and all the associated pleasure, but notices little to no seminal fluid being physically released. In my clinic, this phenomenon is often described to me by patients as an empty orgasm, a term that vividly captures the discrepancy between what is expected and what is actually experienced. And it is precisely this discrepancy that fuels much of the worry and anxiety. I truly understand the depth of that concern. You have, quite naturally, become accustomed to a consistent physical manifestation of this event throughout your life. However, it is paramount to grasp that your fundamental capacity to feel pleasure, a capacity primarily governed by your nerves and brain, can remain entirely intact and unaffected. The changes you might be experiencing relate more to the mechanical delivery system, the plumbing of your body, rather than necessarily indicating a loss of your fundamental virility or your ability to experience sexual satisfaction. It simply means that a specific component of your body's intricate plumbing system may have a discernible and often treatable reason for this alteration. Before we meticulously count down and explore the primary causes of this phenomenon, a quick yet important pause. If you are finding this information valuable, insightful, and believe it possesses the potential to genuinely assist other men grappling with similar concerns, I sincerely encourage you to take a brief moment to hit that like button. This simple action serves as a powerful signal to platforms like YouTube that this content is important and helpful, thereby assisting it in reaching a significantly wider audience of men who truly need it. Furthermore, please consider subscribing to our channel to join our rapidly growing and supportive community of men who are proactively committed to understanding and improving their health and overall well-being. And I wholeheartedly encourage you to take a moment to drop a comment below, sharing where in the world you are watching from. It is incredibly inspiring and profoundly moving to witness this burgeoning brotherhood of men supporting each other, sharing experiences, and seeking knowledge from across continents. Now let's proceed to break down the three most common culprits behind the experience of dry ejaculation. Understanding the why behind this change is your absolutely first and most crucial step toward regaining a profound sense of control and clarity regarding your health. The first and overwhelmingly most common cause we frequently encounter is what medical professionals refer to as retrograde ejaculation. To visualize this concept, picture the exit of your bladder as having a small, highly specialized muscular valve, much like a meticulous gatekeeper diligently guarding a crucial passage. During the powerful, rhythmic contractions that characterize climax, this valve is precisely engineered to clamp down firmly and tightly. This critical action ensures that the seminal fluid, having only one possible path to take, is propelled forward and out of the body. However, in cases of retrograde ejaculation, this essential valve either fails to close completely or doesn't seal tightly enough. As an unfortunate consequence, the seminal fluid, always seeking the path of least resistance, flows backward into the bladder instead of moving forward and exiting the body. You will still fully experience the intense pleasure and complete neurological sensation of climax, but because the fluid has not exited externally, it feels as though the event was dry. A common and often non-alarming practical clue that can indicate this condition is noticing that your urine appears distinctly cloudier than usual immediately after engaging in intimate activity. This happens because the seminal fluid has now mixed with your urine within the bladder. The practical causes for this phenomenon are quite varied and diverse. It frequently occurs after certain surgical procedures that involve the prostate or bladder. While these surgeries are often critically successful and medically necessary for other health issues, they can sometimes inadvertently affect the delicate nerves that meticulously control this crucial bladder neck valve. Additionally, retrograde ejaculation is a known potential side effect of specific medications that are commonly prescribed to treat conditions such as high blood pressure or an enlarged prostate, benign prostatic hyperplasia, or BPH. These medications frequently work by relaxing smooth muscles throughout the body, and unfortunately, this relaxing effect can extend to the tiny, vital muscle that controls this bladder neck valve, compromising its ability to close effectively. I vividly recall a patient, a remarkably proud and accomplished man, who was understandably distraught by this change after a successful prostate surgery. When he came to understand that his dry ejaculation was purely a mechanical alteration, akin to a sophisticated traffic light that had become inadvertently stuck in an open position, and that his intrinsic desire, capacity, and ability to experience pleasure were completely unaffected, he experienced an immense and palpable sense of relief. Our second major cause behind dry ejaculation is what we categorize as duct obstruction. This condition refers specifically to a physical blockage within the small, intricate ducts through which the seminal fluid must meticulously pass on its journey from the seminal vesicles and other contributing glands to the urethra. Biologically speaking, the glands within your reproductive system are still diligently producing the seminal fluid as usual. There is no issue with production itself. However, if you imagine these small ducts as narrow, vital delivery pipes, it becomes clear that if these pipes become blocked or constricted, the delivery vehicle, the fluid itself, simply cannot pass through effectively. Consequently, the volume of fluid expelled during climax drastically decreases, or in some cases, might even disappear entirely, even though the internal production of fluid remains perfectly normal. The practical causes of these types of blockages can include the formation of scar tissue that sometimes results from past infections, such as a severe and untreated bout of prostatitis, inflammation of the prostate gland. Less commonly, small calcifications, essentially tiny stone-like formations, can develop within these ducts and physically obstruct the passage of fluid. The practical signs of such an obstruction can be quite subtle and might not always be immediately apparent. Some men report experiencing a new, mild discomfort or a feeling of pressure in the pelvic region, specifically during climax. Others might have observed, over a prolonged period, that the seminal fluid they do expel has become progressively thicker in consistency and noticeably less abundant in volume. The excellent news in many of these cases is that a significant number of these obstructions are indeed treatable. They can often be successfully cleared with targeted medication aimed at managing underlying inflammation, or, if deemed necessary, through minimally invasive surgical procedures specifically designed to restore normal, unimpeded fluid flow. The third significant area that warrants thorough investigation when considering the causes of dry ejaculation relates to crucial hormonal factors, and more specifically to low testosterone levels. Testosterone acts as the primary and indispensable fuel for the entire male reproductive system. Its role extends far beyond merely regulating sexual desire and sperm production. It is also absolutely critical for the optimal functioning of the prostate gland and the seminal vesicles, the very glands that contribute the bulk of the seminal fluid. When testosterone levels drop significantly below a healthy threshold, the entire reproductive system begins to slow down and operate less efficiently. Initially, you might primarily notice a reduction in the volume of seminal fluid produced and expelled. However, over a more extended period, this hormonal deficiency can manifest itself in other, broader ways, such as a noticeable decrease in libido, less firm or consistent erections, and a generally less intense or satisfying sensation during climax. On a broader systemic level, men experiencing chronically low testosterone often report increased levels of fatigue, inexplicable mood swings, and a noticeable loss of muscle mass, alongside an increase in body fat. The practical solution in such cases frequently involves addressing a recognized medical condition known as hypogonadism, which is essentially a treatable hormonal deficiency. If a simple, definitive blood test confirms the presence of this deficiency, carefully managed and supervised hormone replacement therapy, HRT, can often restore not only better fluid production, but also lead to significant improvements in energy levels, rekindled desire, enhanced mood, and an overall improvement in the quality of life. It is a profound mistake to simply dismiss these symptoms as an inevitable or unavoidable part of the aging process. While aging can play a role, specific hormonal deficiencies are often treatable. While it is true that most of the time these causes are entirely manageable and often effectively treatable, as your doctor, I am professionally obligated to also address the critical exceptions and potential warning signs. Dry ejaculation can, on rare but significant occasions, serve as a potent red flag for a more serious, underlying medical condition that demands immediate attention. This is precisely why paying extremely close attention to any accompanying symptoms is absolutely crucial. You should seek immediate medical attention and a prompt urological evaluation if dry ejaculation appears suddenly and without any apparent explanation, especially if it is accompanied by other concerning symptoms such as pain, the presence of blood in your urine or seminal fluid, a persistent fever, or any new loss of sensation in the genital area. These are urgent and unmistakable signals that demand an immediate and thorough urological evaluation, as they could indicate more severe health issues. Certain neurological diseases such as Parkinson's disease, uncontrolled and long-standing diabetes, or in very rare and unfortunate instances, specific types of urological cancers can interfere with the complex plumbing or the precise nerve signals that are intricately involved in the process of ejaculation. Beyond the purely physical and physiological aspects, we cannot, and indeed must not, overlook the profound emotional and psychological toll that this experience can exact on a man. Many men, either consciously or unconsciously, deeply equate the visible presence of seminal fluid with their sexual performance, their potency, and their overall sense of virility and masculinity. When this physical manifestation disappears, feelings of inadequacy, heightened anxiety, frustration, and even shame can take deep root, often leading to a debilitating cycle of avoidance. It is distressingly common for men to begin to avoid intimate encounters altogether, driven by a profound fear of being judged by their partner or of feeling somehow incomplete, diminished, or less manly during sexual interactions. The emotional reassurance that is absolutely paramount in effectively breaking this cycle typically emanates from two key interlinked sources: accurate information and open, honest communication. Understanding that this is primarily a physiological change rather than a personal failing or a sign of diminished worth can lift an enormous emotional weight from a man's shoulders. Your fundamental ability to experience pleasure, to achieve and maintain erections, and to enjoy genuine, deep emotional and physical connection does not solely, or even primarily, hinge on the visible presence of seminal fluid. Your intimate life can, and indeed should, remain a vibrant, fulfilling, and profoundly joyful source of connection and satisfaction. To bring this crucial discussion to a comprehensive and empowering close, I wish to leave you with a clear, supportive, and actionable plan to help you confidently regain control of this significant aspect of your health and well-being. Firstly, and emphatically, do not ignore it. Instead, investigate it thoroughly. A sudden onset of dry ejaculation or a progressive worsening of the condition over time absolutely warrants a timely visit to a qualified urologist. Often, a straightforward and detailed medical history, a comprehensive physical examination, and perhaps a simple blood or urine test are all that is needed to arrive at a clear, definitive diagnosis. Early diagnosis is key to effective management. Secondly, proactively control any underlying medical conditions. It is absolutely vital to effectively manage chronic health issues such as diabetes, high blood pressure, and elevated cholesterol levels. These pervasive conditions have a direct and significant impact on the vascular and nerve health that fundamentally underpins the entire ejaculatory process and indeed overall sexual function. Proper management can mitigate or even reverse some of these issues. Thirdly, and perhaps most importantly of all, break the silence. Speak openly, honestly, and without reservation with your partner, and of course with your trusted doctor. Articulating what you are experiencing, putting words to your concerns and fears is not only immensely liberating, but also paves the most direct and effective way for finding appropriate and beneficial solutions. Remember that professional support, whether it involves carefully adjusting medications, exploring specific medical treatments, or minimally invasive procedures, or simply receiving accurate, reassuring information and guidance, is your most powerful tool for restoring confidence, peace of mind, and overall well-being. In summary, gentlemen, the absence of seminal fluid during climax is not an indictment of your intimate life, nor is it a definitive verdict on lost masculinity or virility. It is, unequivocally, a signal from your body, a message that deserves to be heard, understood, and meticulously investigated with the expert guidance of a qualified medical professional. Understanding the precise root cause, whether it proves to be mechanical, obstructive, or hormonal in nature, is the absolutely crucial first step toward achieving lasting peace of mind and regaining control. I have personally witnessed countless men regain their confidence, rediscover their vitality, and reignite their inherent joy in living fully after receiving a clear, compassionate diagnosis and a tailored, effective action plan. Your true vitality is not, and never has been, measured in milliliters of fluid, but rather in your overall physical and mental health, your profound sense of well-being, and your enduring capacity to live life fully, engaging deeply and meaningfully with others. Do not allow doubt, unwarranted shame, or unfounded fear to prevent you from seeking the answers, the understanding, and the solutions you genuinely deserve. Acting promptly, decisively, and with an informed perspective can entirely transform your experience, restoring the security, comfort, and intimate connection that you are inherently entitled to. If you have found genuine value in this comprehensive information and believe it can be beneficial to others, please consider sharing it with a friend, a father, a brother, or any man in your life who might be struggling with similar unspoken concerns. This knowledge, when shared, has the power to genuinely shift a person's perspective, alleviate anxiety, and prompt necessary action. Please leave a like to help this vital message reach more men who might significantly benefit from it. And of course, subscribe to the channel, ensuring you turn on notifications so you don't miss our upcoming content, all dedicated to men's vital health and well-being. Always remember, your best, most vibrant years can absolutely still lie ahead of you. Character count check, I 24,500 characters.